Being a nurse is a privilege. So many people let you into their lives during their most vulnerable times, at the beginning of life and at the end of life. And the nurses here at Champlain Valley Physicians Hospital, every one of them brings an individual contribution every day when they come to work across this organization. And those contributions make a pretty amazing story. They are an inspiration to me every day, and they are why I come to work to help support every one of them to do the best job they can to take care of patients. Our nurses come to work every day dedicated to the things they do to take the best possible care of our patients and our community through the use of their head, hands, and heart. I find meaning in my work by helping our patients to live a full life, regardless of the conditions that they are faced with.
I find meaning in my work every day by reviewing current practices and future processes to bring the best patient care to the bedside.
By keeping my patient's safety first and helping keep my coworkers safe and injury-free.
When I work with families and patients, a lot of my job is relationship-based care. Through that care, I'm able to get meaning for myself as well as for the patient and family.
Continuous professional development in my role is something that's continually changing, whether I'm reading journal articles or listening to podcasts or communicating with my coworkers, working towards different certifications. This supports my work as a registered nurse and is very important to me.
I use evidence-based practice every day, helping our patients to find what works for them, whether that's reaching out to other nurses in the industry, organizations, that we stay on top of the newest information and the newest products that are out there for our patients.
I use evidence by knowing where my resources are. I work with physicians and pharmacists and my other coworkers to remain up to date. In the emergency department, we're the first place that patients come, and it's saving their lives if I know what's the most up-to-date evidence.
Ways that I improve the patient experience is introducing innovative technologies to the bedside to improve patient outcomes and quality in patient care.
I really try and provide the most personalized care I possibly can, and a huge amount of that is in communicating with the patient and family about what their needs are. Our care is not solely about the patient, it's also about the family.
In our area, things happen very quickly and teamwork looks like constant communication. Did a coworker think of this? Have we communicated what the patient might have said to the physician versus the nurse?
Is collaborative decision-making to reduce risk for patients.
We work very closely as a team. We're communicating on a regular basis about what's going on with various patients in the hospital and making sure that if something urgent comes up that one of us is able to attend to it as quickly as possible.
We get patients ready together. One person may be doing the interview, one person may put the allergies and information in the computer, another person may be starting their IV. We all come together to get the person ready so that they're on time for their procedure.
I incorporate shared decision-making by building relationships through the hospital. I know that we have a wealth of resources, and the more people I meet, I can call them and say, I know that I've heard that you've been working on this project. How can I incorporate that here in the ER? How can I help you do your work? And that communication has really led to a lot of shared decision-making.
I use my head to integrate computer science, nursing science, and information science to be delivered at the bedside.
Questioning, communicating, learning something new.
To think about patient situations and to talk to patients and families about the care that they specifically need to help figure out what within the hospital can get them that care.
I use my hands to demonstrate to my coworkers the use of proper safe patient handling equipment.
I use my hands to physically take care of patients and families as well as to comfort them when there's a time of loss.
I use my heart in caring for my patients. As they once become our patient, they're our patient for the rest of their lives.
I use my heart to show compassion to the care that I provide to patients, our people, and community.
to provide the most compassionate care that I can for patients and families when they're most vulnerable.
My heart is where I connect back to my meaning. I try to empathize with my patients. Why are they here? What are they asking of us, and how can I help them be heard? Becoming a nurse is the best thing that I've ever done.